Lung cancer is one of the most common diagnoses of cancer in our country. It is the second most common diagnosed cancer in both men and women, but it's the leading killer of all cancer deaths in the United States. Approximately 75% of patients that are diagnosed with lung cancer will die from it, and that's why it's a very serious disease. Unfortunately, it is tied to a very preventable cause, which is smoking in over 90% of the cases. And so we have a big health crisis here in dealing with smoking and with lung cancer. The biggest problems with diagnosing and treating lung cancer is that it's diagnosed at a late stage, typically stage 4. We can't cure patients at stage 4 lung cancer, and we rarely cure patients when they're diagnosed at stage 3. Unlike other cancers, lung cancer can spread throughout your body without you knowing it. It doesn't typically cause pain or respiratory symptoms until very late in the diagnosis. And so the best way to make a huge impact in curing lung cancer is to diagnose it early. We know that the patients or people in the community that are at highest risk for lung cancer are smokers, especially older smokers who have a long history of smoking cigarettes. We typically like to focus on patients who are aged 55 to 74 who have smoked at least 1 pack of cigarettes per day for 30 years, also known as a 30-pack year history. So these are heavy smokers or former heavy smokers that are at highest risk and would benefit from getting lung cancer screening. Patients or people who have smoked 10 cigarettes or half a pack or smoked for 10 years don't have a high enough risk to benefit from lung cancer screening with the CAT scanner. And so we have adopted a number of screening tests for breast cancer, which are mammograms, cervical cancers to pap smear test, which has made an enormous difference in saving lives, as well as colon cancer screening with colonoscopies. And so lung cancer became a big target of trying to find a way to make an impact in curing people's cancer. And so chest x-ray studies have been done for several years, and unfortunately they never showed any improvement in survival. By diagnosing lung cancer at stage 1, we have an enormous impact in curing that patient by having surgery early. And so we think that this technology of doing rapid, fast CT scans in patients that are at high risk for lung cancer can make a huge difference in saving their lives and diagnosing the disease at stage 1 or stage 2 when we can intervene and make a difference.